The main point of this narrative was to really highlight my story about how many American training institutions still have a far way to go in accommodating the increased diversity of students who will become the staff of tomorrow. I think medical schools have done a great job of increasing diversity in trainees, and there's still some more work that needs to be done in that regard. But there also has to be new institutional changes that need to be implemented to accommodate and include these new diverse trainees. Hello, everyone. My name is Rowan Abdilwahab, and I am a second-year medical student at Mayo Clinic Alec School of Medicine. And we'll be talking a little bit about this narrative piece that will be in an upcoming issue of Mayo Clinic Proceedings. The challenges that I faced and highlighted in this narrative undoubtedly exist in other medical communities, and I found that to be the case, although this narrative specifically focuses on my story. And in most cases, hospitals already may possess the PPE that is necessary to adapt and accommodate everyone's needs. So this personal perspective provides some insight into how, when these needs are not met, as a new trainee in a new institution, kind of navigating the different hierarchies and such, what sort of personal experience and impact it can have on trainees throughout their experience. As a first-year medical student who was reflecting on my first experience learning about surgical education and the scrubbing in process, I feel as though there was a lot of gaps in the curriculum that resulted in me not only feeling that I wasn't welcome at the institution, but also didn't provide me with the necessary skills to learn how to even exist in the OR. As a medical student, we are expected to learn certain types of skills, like how to scrub in so we can take care of our patients. But with the existing gaps at the time, there was no knowledge on how I could scrub in with a religious head covering. And thus, I came out of that session that was intended to teach me these necessary skills for the rest of my medical career. And I was left not knowing how to do any of that. And it was actually something I had to actively seek out for months after the session to even facilitate the ability to step into an operating room. I feel as though it should not have been necessary for the least empowered member of a new institution and the surgical team to assert her right alone. In my case, to stay true to my cultural and spiritual values. And I hope people take out of this article that everyone on the surgical teams, especially their leaders, should try to attune themselves to the diverse needs of all members. If they notice there are gaps in the educations, really partner with said trainee in addressing those gaps and adapting surgical garb to meet those needs. Through formally established education describing the location and proper use of these resources, maybe through the diversity, equity, and inclusion committees at institutions, we can really make it so everyone feels like they belong. Thankfully, I found a lot of amazing mentors here at Mayo that really helped me find the resources I needed to learn how to scrub in. I've now been in the operating rooms a couple of times since, and I think that sort of support from the institution when I highlighted gaps that I noticed really made it so I didn't completely rule out surgery as a field, because I know that is an experience that different students may have if they feel like there isn't a space for them in certain medical arenas. And we know that increased diversity has also been shown to be associated with improved clinical outcomes, improved patient satisfaction and compliance, as well as reducing clinical uncertainty regarding diagnosis and treatment. Because if students that are recruited to the medical school cannot learn basic medical skills, we are really depriving them of all of the knowledge they need to be an excellent doctor, which is what we hope to take out of this whole experience. So our goal is that this will be instituted in curriculums across the nation. Actually, in response to an article my mentors and I here at Mayo wrote, there were changes in national surgical attire guidelines that now include religious head coverings in the guidelines, which were not included prior to when we had written a little bit about this. So I think The first step is awareness. The second step is pointing to these resources that hopefully I mentioned a couple, some of the articles I wrote, and now the changes in national guidelines by the Association of Perioperative Nurses that can be referred to across institutions. But although national guidelines have been changed, it's really up to each institution to really take on that initiative and change their institutional policies and practices, because the national guidelines inform institutional policies, but it's up to the discretion of each institution to change their climate, their culture, their education in accordance to that. The next sort of steps for this research is really meant to just highlight this existing gap in medical education, and surely there are many others. Since this narrative was written as a reflective piece to kind of highlight this issue, my colleagues and I here at Mayo have written a couple of manuscripts, one being a multicultural guide to the OR and ICU, and a checklist for the OR and ICU as educational materials that can highlight some of those gaps that we noticed while I was a trainee. There is also a need to integrate these into the medical curriculum. So by spotlighting this issue and showing the personal perspective, we hope we can provide insight as to why it's imperative to swiftly address these gaps in medical education with some of the resources like the ones I mentioned before. And it's especially important for there to be spaces devoted to diversity, equity, and inclusion, whether that be councils, whether that be safe spaces for students and for other trainees to really speak to mentors that they can trust, so they have the ability to even highlight and address these gaps in medical education. And I'm really excited to say that here at Mayo, there has been a new shelf installed in the locker room since I started learning about the scrubbing in process, that now has those orthopedic hoods that we found to be the solution to several of the specific PPE needs of diverse trainees. And this new shelf now has it in a convenient place for trainees. So in this way, a simple solution brought up by just talking to people, hopefully highlighting it on the national stage, like we are doing here with this narrative. And hopefully it provides you with some resources and motivation to really take on this work and make it so that we're training truly competent doctors across the nation. Thank you all.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.